And this is put on by, this is not my film clip, this was put on by, or designed by Frameworks, and I hope that you enjoy it.
The following presentation summarizes the results of the initial phases of Framework's larger project on how the public thinks about environmental health. The goal of this project is to help experts and advocates communicate more strategically with the general public about the topic of environmental health, employing messages that have been tested using both quantitative and qualitative methods. This investigation is grounded in an approach to communication called strategic frame analysis, which draws on decades of research from the cognitive and social sciences on how human beings understand and process information. As a part of our work of identifying effective strategies for communicating difficult social problems, we first investigate the patterns of reasoning that people rely on to make sense of information. Anthropologists call these patterns of reasoning cultural models. In this case, we're interested in the cultural models that average Americans employ to think about the specific topic of environmental health. For this research, we also conducted a literature review and interviewed experts to see how they think and talk about environmental health. The research presented here maps the gaps between public and expert understandings of environmental health and serves as a first step in identifying more effective communication strategies with the public. Our analysis is based on 21 in-depth interviews conducted in May and June of 2010 with civically engaged individuals in Dallas, Texas, South Bend, Indiana, Boulder, Colorado, and Cleveland, Ohio. All of the informants were selected through a professional recruiting firm and represent variation in terms of gender, age, ethnicity, education, and political affiliation. In this presentation, you'll hear informants' real voices as they respond to questions about environmental health. Keep in mind that cultural models interviews are not only concerned with what people think, but in how they think about an issue. In other words, researchers are looking to identify broad patterns of thinking that emerge as informants try to make meaning out of information. As you listen to these informants, it's important to keep in mind that experts have a clear set of messages about environmental health challenges, the work of environmental health, and the critical importance of that work. This stands in marked contrast to the interviews you will hear from ordinary Americans who struggle to understand the broader context and conditions that lead to environmental health problems, and to appreciate the work that goes into addressing these challenges.
Well, I think everybody has a personal responsibility to, think about how their actions are affecting all of the topics that you just brought up. Yeah. I think everyone has the personal responsibility to themselves and to the people that even people that live in the environment with them and the people who are coming long after we're gone. I think everyone has a responsibility to think about how they're affecting each one of those topics.
Interviews revealed that many members of the public have an unclear understanding of the term environmental health. Many, in fact, think that it refers to the health of the environment rather than environmental impacts on human health. While the public was generally comfortable defining the separate domains of environment and health, many struggled to see how the two were related in the single term, environmental health.
I would assign the term environmental to the earth, to the natural elements of the earth. When I hear the word health, I don't associate the word health with the planet.
Often, people thought about environment in terms of environmentalism, and health in terms of individual behaviors. Despite their unfamiliarity with the term and their tendency to drift into discussions of environmentalism or individualism, the public does have a robust model of environmental threats to human health, specifically in the form of contaminant threats to the safety of their food, water, and air.
If you were to open the newspaper tomorrow and see environmental health in a title and nothing more, what would you think that story was going to be about?
What's in our air, what's in our drinking water, our food, diseases, where people live, what are they drinking, contaminants, the atmosphere.
Despite this strong model for thinking about environmental health threats, the public has a weak and fragmented model for thinking about environmental health work. Informants struggled when asked what organizations, individuals, and systems are responsible for maintaining good environmental health.
I think they would involve doctors, possibly nurses.
Despite difficulty describing who does environmental health work, informants have strong ideas about who is responsible for environmental health threats and impacts. In fact, they regularly toggle between both ideal and real descriptions of three primary agents: government, individuals, and businesses. In their ideal vision, government provides a check on potential abuses by big businesses.
But I think they've got to keep an eye on big business, because I don't think industry is going to patrol itself. That would be like saying, okay, here's all these rules for the road. Now, we know that there's a policeman at every corner, but just knowing that there are police out there, it makes you think, well, hey, I better be careful that I don't break these rules. So I think we need somebody to patrol industry.
But a more skeptical model often emerges to describe how it really works.
Yeah, I'm old enough now where I remember Jimmy Carter sitting in front of the fireplace back in the middle 70s saying we need alternative energies. And I think that's one of the reasons that I've become an activist, because I know that the reason we haven't progressed is because the people in charge of deciding the direction of our country have taken the bribes from the oil companies to make sure nothing changes, to make sure we stay in the dark ages, to promote their obscene profits at the expense of our health.
The public also has an ideal vision of business responsibility.
The big industrial companies that I'm sure are concerned about pollution and making sure that it's not giving out too much pollution. I don't know how they've done that to make sure that it is safe, but I'm sure they are.
Many informants, however, invoke a more skeptical model to describe how business really works.
People want to make as much money as they can because they want you addicted to their products. They want you to get a taste for their food so that you can keep coming back and, and spending more money on it. They want to make sure that you're getting just enough to fill you up at that moment, and then in the next, hour or so, you're going to be hungry again, so you can come back and get some more. It's a control mechanism.
Finally, both ideal and real models also apply to thinking about individual responsibility.
I know just in general, I'm like one of those people that just wants to be happy all the time and doesn't want to, have a bad thought in my mind. And if you just look away, you can pretend that coal plant doesn't exist, and because it just will ruin your day.
While the public holds this three-way model of responsibility, it is an ideal version of the individualist model that dominated thinking about what should be done to address and solve environmental health problems.
We are all responsible to be good citizens and to recycle, to make sure we're not polluting our water. For instance, you can throw away chemicals and that can end up in the water, or you can flush stuff down your toilet that ends up in the water. I know that there's been things on the news about all of the prescription drugs that are showing up in our water system.
In summary, Americans lack a clear understanding of the term environmental health and borrow from their senses of environmentalism and healthcare to try to make sense of the term. Once they come to think about environmental health efforts, the public has a distributed model of responsibility, but a tendency to default to assigning primary responsibility to individuals at the household and to some extent community level. While there are several important areas of overlap between this public understanding and expert opinion, there are also several important gaps between them. Let's take a closer look at the large gaps that exist between how Americans and experts understand environmental health. The public sees environmental health threats as important pieces of the narrative, but fails to appreciate important preventative and protective efforts being made by those working in the field. Experts, on the other hand, connect the critical role of environmental health agents in protecting the public and promoting environmental conditions for healthy living. Secondly, experts speak to environmental health impacts from the local to global scales, while the public overwhelmingly thinks in local, or at best regional terms. Experts clearly view global events, such as climate change, as core emergent concerns for environmental health. However, shifting to a global perspective moves the public into an environmentalist model that draws thinking away from human health. Public informants consistently viewed individual behavior and collective values as key spheres of influence for environmental health action, whereas experts focus on the impact of population-level interventions and public policy as the key arenas for addressing environmental health challenges. Both experts and public informants spoke to a core concern with material contaminant threats to human health. Yet experts focus on broader behavioral, social, economic, and infrastructural factors that impact patterns of human health in both positive and negative ways. The public's dominant contaminant model does not account for these other mechanisms. These gaps represent critical sites to address in an effort to expand public thinking about environmental impacts on human health, as well as influence public and policy structures that can promote and build healthy environments for healthy living. Fortunately, there are features of public thinking that already suggest ways to begin bridging some of these gaps. In addition to the dominant models described previously, the public also has ways of thinking that are less strong or top of mind, but which nonetheless exist as part of the cultural landscape of their thinking. We call these less frequently used models recessive cultural models, and pursue them as promising avenues for engaging the public in more productive understandings of environmental health. For example, when informants were able to think outside of the dominant contaminant model, they were occasionally able to see the non-chemical aspects of environments and recognize that such factors affect human health.
Well, think about a child that grows up in an urban area that's parents both work, that is maybe poor, that can't afford the good organic food or the water. I mean, eating garbage. I mean, the school lunches are awful, and some of these kids can't afford anything else. So why wouldn't that be their environment? Sure, it should be. I mean, they have no choice compared to maybe the child that lives in a rural environment that's mother's home every day and that's cooking them, healthy foods. And I think the poorer the children are, the less choice they have.
These comments demonstrate that Americans, with some priming, are able to widen their scope of thinking about how conditions of health are created and distributed across environments. Frameworks research on environmental health can shape how experts and advocates advance their communication strategies, even at this preliminary stage of the investigation. We recommend 5 communication strategies. Focus communication on the effective and evidence-based work that has been and is being conducted within the field. Keep communication focused on people's health to help avoid the cognitive drift into environmentalism. Clarify the roles of assorted federal, state, and local departments working in environmental health by identifying the contours of their common mandate. Give government a participatory role in protecting citizens from environmental factors beyond personal control, but do so with caution. While the protective model of government can be fruitful, it can also invoke negative associations with a nanny government. Invoke the contaminant model with great care. While contamination represents an arena of critical concern by the public, and rightly so, the contaminant model can mute thinking about broader environmental factors. Frameworks Institute is now prepared to take what we've learned from the expert and lay stories of environmental health and move forward into prescriptive research in developing and testing frame elements such as values and simplifying models that, taken together, address the conceptual challenges and gaps in understanding that have been presented here.
Okay, any initial thoughts on this short video? Any knee-jerk kinds of considerations? Is this old news, something new, something different? Someone want to break the ice for us here this morning? Thanks, Richard.
I am not surprised by the results that were found in terms of what the public thinks or perceives that what environmental health is. It's interesting, though, in the area where I'm in California, it's translated somewhat to a different discussion of regulatory review and the effect of regulatory agencies in driving businesses away from California.
So the frame that is, it's a business frame then.
Correct.
Right?
It's much more trying to be business friendly and being viewed as not being business friendly.
Mm-hmm. Mm-hmm. Other thoughts? Okay, can you identify, in addition to what Richard has noted, how about your coworkers' frames or your clients' or customers' frames? Any sense of how they see the world differently than you do as an individual going about your daily business?
Yeah, particularly because I work for a Coupa and we see this a lot, and there's been a drastic changes in our fees, and so when we go there, we're kind of, oh, you're just trying to get money from us, and we try to find, well, we have responsibility for this, and they're looking at the bottom line, and they're, it's really difficult lately, particularly the smaller businesses to try to stay afloat. We come by, we do our job. We have a more holistic look at what we're doing, but then they're looking more like, well, we're paying fees, and they only see dollar signs on us when we go out there.
Okay.
I have another one. What about anybody see a different frame between the state and the local? Have you experienced any framing differences between the way local Coupas look at things and state regulators look at things? Any examples?
Right. So recently, there's been a lot of a little more stringent regulations, and here for us as inspectors at the ground level, we see things a little bit differently, and we're seeing sort of how it's affecting businesses. And so I don't think sometimes why is the state putting that down right now? And particularly when they're pushing a lot of the work on the Coupas, on these inspecting and implementing these regulations. So there's a vast disparity in how we think and how their policies work on top and how it works on the ground.
Has anybody heard the statement regarding the California Environmental Reporting System that everybody has a computer? As a local person, is it your experience that all of your regulated businesses have a computer? So that we might have some different ways in which we look at our customers based on our experiences with our customers. Or so we might have a different frame of our problem when we're talking about automating information. I'm assuming that'll be a big topic of this conference.
Last Thursday, it was my privilege to participate in a meeting with the Assistant Secretary for Planning and Evaluation out of the U.S. Department of Health and Human Services. And the subject was informatics. What does the future of informatics and public health look like? And these are the people with the budgets and some really bright guys that were there. And when we talk about informatics, of course we're talking about technology, we're talking about handhelds, we're talking about architecture, we're talking about a variety of different things, both for hardware and software. And the meeting started like this one at 8 o'clock in the morning. At about 2 in the afternoon, after listening to, for those of you that are involved in the broader conversation about CMS, Medicaid, Medicare, reimbursements, the Affordable Care Act, and the idea is that the conversation was about public health informatics. It wasn't about clinical care informatics. But by 2 in the afternoon, I hadn't heard anything about one of the major components of what we do in this public health profession continuously. What are the 3 core functions in public health? Assessment, assurance, and policy development. do you guys collect data? Do you produce data? Do you report data? And so I raised my hand with all these really bright technical guys and said, well, wait a second. What about the environmental health profession? And you should have seen the blank look on these very smart people's eyes, people who control big budgets. And they're like, what are you talking about? I'm like, if you look at local public health, because public health, what you do every day affects your local community. I live in a local community. I don't live all over the country. I live in one place. Having said that, most of the 2,800 local health departments, like 99% of them have one thing in common. You know what that is? Environmental health. In fact, I say to audiences much larger than this one, public health is really part of environmental health and not the other way around. If you look at the regulatory function, the inspections, and the things that we do on a day-to-day basis, I could make a very strong case on why environmental health is really the anchor for everything that we do in prevention and protection in this country. And so those folks needed to be reframed about what public health is. They were thinking about the clinical care model and not the prevention model that most of us spend most of our time addressing. Let's think about what we see in politics right now, and this is a very amusing illustration, just to see how this affects you on a day-to-day basis. As you know, Gingrich lost to Mitt Romney in Florida, 46% to 32%. What was this, just last week? What does the press say? And I just pulled this off the internet. Romney demolishes Gingrich, right? I guess in politics, that's a big difference. Romney, what does he say? I'm the best man to beat Obama. What does Gingrich say? This is brilliant. This is absolutely brilliant. It's now a two-man race. Notice his frame, he's trying to frame his message, and the way he thinks is, all the other players are unimportant. Even though he got trounced, he is still framing this in a way that's successful to him. And then Ron Paul, I'm not sure what he was thinking. He said 1913 wasn't a very good year. 1913 gave us the income tax, the 16th Amendment, and the IRS. So I'm not sure what Ron Paul's frame is, but it's certainly not anything germane to that dialogue. 2 weeks ago, I convened a national phone call. We had about 93 health departments on the line together with the U.S. Centers for Disease Control. And what we talked about was this phenomenon, Occupy Wall Street. Did you have Occupy Wall Street near you, where you work, or in your community? As of last week, at McPherson Square, which is like 2 blocks from my office, just a few blocks from the White House, there was still a camp there. It had been there for a while. I thought I read in the USA Today that the park police, the National Park Police, were dismantling it as we now speak, maybe even today. But that was like a permanent camp. I mean, like I said, that was just a couple blocks from my office. But 396, almost 400 cities in the US had Occupy Wall Street camps. And the purpose of convening this national phone call was to figure out, what did we learn from it? What was going on? You better believe Occupy Wall Street has not disappeared. Just wait for the presidential conventions, and you're going to see this whole Occupy. I don't guarantee it, but I would love to come back a year from now and reconvene this group and ask the question, did they disappear, or are they here to stay? And the way that different health agencies framed their work around this was actually kind of fascinating. We had a mega city, I'm not going to mention who it is, who was on the phone call, who framed what they did with their local Occupy Wall Street group as a political issue. It was run out of the mayor's office. It was managed politically. There were a couple of other mid-sized cities, one that managed